So Choosing Wisely Canada started 10 years ago, and our goal was really to raise awareness of the problem of overuse of tests and treatments that can be harmful to patients or don't add any value. We knew that about 30% of the red blood cells transfused were not needed. And we had a blood shortage in Canada during the pandemic because people couldn't volunteer to give blood. And it's a precious resource in society. So we started this campaign and we asked hospitals, in this case, to participate by auditing their red blood cell use against 2 criteria that we developed nationally, and then to try to work to reduce their red blood cell use. And if they could meet these benchmarks and maintain them for 4 months, we called them the Using Blood Wisely Hospital. And we were very surprised by how much engagement there was, because we now have about 260 hospitals in Canada, and that accounts for about 80% of the blood use. Really, I think it's very important to have like a chief of staff or a head of a family practice clinic or someone who sees the purpose of doing this and is engaged. But I would say a really important thing that we're trying to do is change a culture. We're trying to engage many people in Canada in discussing this, patients in discussing it, doctors and nurses and others. We do have a patient advisory, and we engage them in all our major decisions. But more broadly, we have had a campaign to try and encourage patients to ask 4 questions. So we always have our 4 questions in everything. Do I really need this test or treatment? What are the downsides? Are there simpler, safer options? And what if I don't do anything and wait? Even though we have quite different healthcare systems, actually the work of working with patients is the same. These are common problems we're working on. And I think the issues of trying to increase awareness and develop those conversations are really the same. And using scientific evidence to try to drive these conversations towards best practices. And what's been very useful is that we do get together once a year in person, and this time in Catalonia, here in Barcelona, to share ideas and to learn from one another.